I didn't really intend to become a nurse. I was working in the bank and I counted money really badly.
So I started way back in 1987.
I graduated in the 70s from nursing, so it's a long time ago.
I started off actually doing a trade, and I didn't really enjoy that, so I kind of was looking for something I could kind of give back to the community.
I actually applied when I was just out of high school to do psychiatric nursing.
I graduated into the graduate program for psychiatric services in Bendigo Health.
Edward James Brown, graduated in the early 60s.
After my 3 years of general training, I did what was called a staff year, which entailed many of the general wards, including the intensive care unit, which was a whole 3 beds, which was virtually a little cupboard off the cardiac ward.
It was the transition of hospital-based training nurses to university-based training nurses. And then I came back to a small hospital known as Elmore. Now at that hospital you did everything. I learnt everything there. You were plastering, you were giving injection there, you were helping deliver babies. You did everything. You checked morphine by yourself. It was just absolutely fantastic.
I think living away from home was the best motivator for nursing.
But because at that point in time, the staff at the old psychiatric centre had a terrible reputation for partying, and my mum and dad didn't want me going into an environment like that.
Many, many funny stories. I nearly set one of the nursing homes on fire because my radiator rolled over, and there's always the late pass that we didn't get, and then people would scurry up the drain pipe to get back into the nursing home, and you know, you'd always be afraid of the supervisor or the matron catching you out without your overcoat on when you're out of the building. So we had to wear a great big trench coat essentially, and we had the hats. And
my title's Chief Nursing and Midwifery Officer. We used to be called the matron. I guess we have a different flavour these days because our Chief Nursing and Midwifery Officers, or ex-matrons as we used to be, can be married and have lives outside of nursing, and all of us seem to do that.
In the 1980s, there was a non-nursing duties dispute, which really saw nurses move from doing the sort of non-nursing duties like cleaning, mopping the floors, those sorts of things, you know. So that was the first sort of major step towards professionalising nursing. So I think the advent of so many kind of safety initiatives that have occurred over the years have also made a significant difference, and more recently the influence of technology, of course.
A lot of challenging times, learning all about the patients, learning how to treat them, watching things evolve. When somebody would have a fractured leg and we would put pins through it and put them up in traction for 6 weeks, nowadays they go to theatre, have a rod put in, and they're home the next day.
The technology, the instruments and the knowledge of the practitioners has just gone amazingly in the right direction, all for the betterment of patient care.
What they can do now is absolutely marvellous, and people live longer for that reason.
Mental health used to be a bit custodial back in the old days. I think we used to kind of try and control people rather than get to know people and be a tool of change ourselves.
In terms of the amount of babies I've seen born over the years, I imagine, I think it would be in the thousands.
Just the experience that senior nurses have had and imparted to me and to other nurses has been really beneficial.
I've been lucky in my career to work with a lot of really talented clinicians that have come from, you know, a wide range of different areas.
And it's actually a privilege to do what we do, and that's how I see it every day. It really is a privilege.
Why would a male nurse be a nurse when it's a girl's job? And, you know, you've got white shoes, white pants, white uniform. Don't know whether you should be a nurse. But now there's a massive amount of male nurses, and they're all the good. It's just the same as a woman is as good as a man, regardless, especially in healthcare.
I think a highlight, although that mightn't be quite the word to use, would be when I was living in Darwin and we did care for the Bali bombing victims for quite a period of time before they were able to move back to their own states.
Milestones throughout my career is the change of the Mental Health Act in 2014, the Royal Commission into mental health.
I think probably the area that I would have seen the most change in is probably in inpatient care.
It's about people, getting back into their life as quickly as possible.
Now we've changed our focus of trying to provide the majority of patient care to people in the community, in their own homes, in their own environments, and minimising the time in hospitals.
The idea that in doing nursing, you're doing something that's worthwhile, that's contributing to the health of society.
When people talk about nursing, to me it's an opportunity to care for people and make a difference in somebody's life.
Nurses has 100 places to go to, from the giving the birth to sending off the people.
Nursing for me is very much a healing, helping, supporting kind of a career that's very rewarding.
One big, massive family. That's nursing. Summed up.